Hello, it's Dr. Brian McDonough. I hope I have some good information today that might be helpful for you, some common questions you might have. As you know, we're approaching cold and flu season. And if you think about it, there's going to be a lot of confusion because coughs, sneeze, fever, all those things are signs of COVID, but they can be signs of other problems as well. And last year, basically, we were pretty much quarantining, so a lot of people did not have that natural exposure to other people. This year, we're out and about. So if you combine the fact that we really didn't build a lot of antibodies to other things last year, along with the fact it's the normal cold and flu season coming up, we're probably going to have a lot of people who are going to have symptoms. Not a bad thing. That's how we build protection. We fight viruses. We do it all the time. But because of the nature of COVID and also concerns about the flu, it becomes a bit more serious. I also want to let you know, I think this is episode 195 of A Doctor of the Pandemic. These things kind of creep up on you. We do so many of them. And I've been doing coronavirus today on the audio side. But you may have noticed we're doing fewer. And I'm doing fewer because there's just fewer things to talk about. I mean, I can only talk about the importance of getting vaccines, washing your hands, social distancing so much, and it becomes repetitious. So I'm just trying to basically give you new information when it occurs. But please reach back and look at the old ones if you find it necessary or helpful. We have all sorts of topics. I was looking at coronavirus today, the audio podcast, and literally was talking in March of 2020, the first one of them, where we talked about, do you need to wear a mask? So it goes way back, lots of information, kind of a history of the pandemic as well, which I don't think any of us want to revisit, but it's there if you want. So let's talk a little about cold and flu season. 3 key points I want to make. First of all, question comes up. If you want to get the COVID-19 vaccine and the flu vaccine at the same time, can you do it? Can you do it safely? According to the CDC, you absolutely can. In fact, in medicine, we've been giving multiple vaccines for quite some time. There's certain ones you don't want to pair. But as far as the COVID vaccine and the flu vaccine, it's a great idea. So if you're thinking about getting your first vaccine for COVID, you can get your flu shot and COVID vaccine at the same time, 2 for the price and time of 1, which is essentially negligible. Or you could maybe get your 3rd booster of the Pfizer along with the flu vaccine. The key with the flu vaccine is we think we're going to have an early season, so we're recommending you get it by the end of October. So if you want to go into your pharmacy or physician, wherever, get it. You ought to, and you also ought to think about the COVID vaccine. So that's number 1. You can get them at the same time. The second question is, what about testing? In other words, we can test for the flu, we can test for COVID. Well, clearly COVID testing is critical because by testing for COVID, you decrease the spread, especially when we have so many unvaccinated people. We want to keep them alive if we possibly can. So you should get tested for the COVID virus. But you also can take a test called a co-test, where they now can look at influenza A, influenza B, and COVID all in one test. So if you're going to do that, you might consider that, especially if you're having symptoms. Remember, we have overlap of symptoms. You know, the congestion, the fever, the cough, the shortness of breath, the fatigue, the malaise, all those things kind of run through both of those viruses. And since we're going to have things out, we're going to have influenza, we're going to have COVID, plus all the natural viruses that aren't quite as dramatic that we get, they're going to be an issue. The other thing I want to talk about is something else to even confuse it more. It's respiratory syncytial virus, or RSV, a very common virus. By and large, benign. People get it, and they kick through it within the first 5 to 7 days. Very common in children. It usually occurs November, December, January, the winter months, but we're seeing it earlier. And the reason we're seeing it earlier, the theory is because kids, again, weren't exposed to each other, so they're all getting it at once. They hadn't built antibodies. Now, here's the concern with RSV. It attacks mostly between the ages of birth to 2. And kids normally get some mucus, they might get a little dehydrated, they fight through it, they're okay. But some babies, especially newborns, premature babies, and others at high risk, again, people who have underlying issues even when they're in those first couple of years of life, they can be hospitalized and they're put on oxygen, they are given fluids, we do whatever we can to treat them. And I'll tell you, there is definitely a lot of pediatric hospitals that are crowded with children with RSV. So we're seeing that as well. So it's going to be a junky cold and flu season. I hope this summary is helpful. If you find these things helpful, just let me know. Reach out to me. And obviously, if you want to subscribe, that's great. I don't take any funding for this. I don't care about funding for this. So if you don't subscribe, it doesn't break my heart. But if you subscribe, it's nice because it's easier for you to get the information. Have a good day.